To become the best possible nurse that you can be, it is crucial that you learn effective speaking. You are in constant communication on a daily basis with patients, coworkers such as doctors and nurses, receptionists, so a lot of different groups of people. So it is very important that you get your communication skills down. I decided to interview Diana Grinberg, who's been an ED nurse at the UVM Medical Center for 5 years now. I aspire one day, after I graduate nursing school, to also myself become an emergency department nurse. So Nurse Grinberg gave me the lowdown of what effective speaking looks like on a daily basis for herself and things that you should focus on. The first, she said, would be to speak slowly. It is important to take your time when speaking to patients to explain to them the situation, possible diagnoses, medications that they are taking, so they kind of get a better understanding of what is going on. Also, speaking slowly comes into play when you're speaking to coworkers, explaining to them, hey, this is what's going on in this case, I would really like to go about it this way, and really focusing on ensuring that they are understanding what you're saying. Another part that's very important is to speak clearly and not loudly. If you're speaking to a patient that maybe has issues with hearing, it is important that you are speaking as clear as possible. Maybe adding volume to your voice would not really enhance the conversation, but rather clearly emphasizing each word to the person that you are speaking with. Another important thing that is used on a daily basis in the ED is to avoid using slang terms. There are some words that you may think take place of other words that most people will understand and understand what you are trying to relate to them. But in actuality, they really don't understand, and then the message just gets lost with poor communication. So it is important to avoid using slang terms and to always stick straight to the point of what you're trying to present to the person you're speaking with. Another thing to emphasize is to remember your audience. Yes, you are speaking to your patient with some terms, but also to your coworkers with other terms. So a perfect example of this could be, you have medication, omeprazole, which is a PPI, a proton pump inhibitor, and you may say this to your patient and they may step back and think, oh, I really have no idea what this is for. I've never heard that word before. But if you were to use that same terminology with a coworker, such as a nurse or a doctor, they would immediately understand what you were saying without any hesitation. So with this, if I were to speak to a coworker, it would be quicker and easier, but if I were to say this to a patient, I would give them more of an understanding of what the medication is used for. So it would be used for gastric issues that they could be presenting with, reflux, any acid issues like that. So just to remember your audience and know who you are speaking to. Another important factor is to stop and listen. Your patient may have a lot of questions about what is going on, so it is important that you really sit down and listen to what they are saying. They may not understand fully the procedure, the medications they are taking, so really take time out of your day to ensure that your patient understands what is going on. Also, another important part of communication, not just verbal, but is using body language. Body language is another way to really communicate with the people around you and another way to read people, not just with verbal cues, but also visual cues. Another thing that you might want to consider is learning a foreign language. You might come across language barriers a lot and throughout your experience at the hospital. So maybe learning a little bit of, let's say, French or Spanish, whatever language your patient presents with, it might be helpful to understand just a few words so you can get better communication with them. And lastly, in terms of communication, something that is important to know is that using your words are not necessarily the only way that you can communicate with people. Writing has been found to be incredibly beneficial, especially with patients that can't verbalize or understand what you're trying to say as well. So using writing might be an incredibly beneficial way to get your message across and really work on the communication that you want to have between your patient and yourself. I found it very, very fun to learn about all of the ways that speaking is prevalent in a nursing environment and how learning how to speak effectively, communicate effectively with your coworkers and the patients themselves, in the end, makes you a much better nurse. Thank you.